Hi, my name is Michelle Rodriguez, and today I will be presenting Think Twice Before Getting an Ultrasound. So let's take a look at some history and where ultrasounds came from. Ultrasounds were developed during World War II, but weren't initially used to see a developing fetus inside the womb of a pregnant woman, or even in the medical field. Instead, they were used mostly in the steel industry and were used to detect enemy submarines. In 1955, a surgeon named Ian Donald borrowed this machine and began to experiment with abdominal tumors that he'd removed from patients. By using beefsteaks as controls, he discovered that different tissues gave different patterns of ultrasound echoes. Soon after this discovery, this new technology made its way to the medical field. So now let's take a look at what an ultrasound really is. An ultrasound is an imaging method, a scan that uses high frequency of sound waves to create pictures of the inside of your body. Because different tissues give off different sound waves, the images produced can be very adequate. Ultrasounds can be measured in a variety of ways, but the most important way to measure the intensity of an ultrasound is by the mechanical index and the thermal index. The mechanical index is a safety metric which measures the amount of energy that's being transmitted to a patient during an exam. The thermal index is another safety metric that lets the operator know the potential of creating heat. With both of these methods, sonographers are to follow the American Institute of Ultrasound in Medicine as low as reasonably achievable policy. This means exactly what it sounds like. The sonographers must keep the output setting as low as possible and can still produce adequate images, which is only about 50%. So what can an ultrasound be used for? It can be used not only to scan a developing fetus, but for kidneys, heart, liver, gallbladder, and even brain scans can be done with an ultrasound. Ultrasounds can be used for early detection or a diagnosis for an abnormality. They can be used for guidance during medical procedures, and they can also be used to determine the due date for the mother to give birth. Though an ultrasound can be a beautiful thing for expecting parents, it can also be very risky. Many expecting mothers don't know about the risks that they impose on a developing fetus. Ultrasounds are only recommended a maximum of 2 times at 12 weeks and 18 weeks of pregnancy. And this is just to establish due date and detect abnormalities. Risks in conducting more than the recommended amount of ultrasounds can cause a miscarriage, delayed speech development or brain development, low birth weight, poor health at birth, and even heating and cavitation. Heating is where the scan ultimately heats the tissues in excess, which can cause damage to the baby's developing brain. Cavitation affects the tissues in the fetus as well, with pockets of gas. These pockets of air can be within the baby's lungs, which can be fatal for the babies after birth. In order to reduce these risks in pregnancies, the expecting mother can limit her scans to a maximum of 2 ultrasounds per pregnancy. Another thing that can be done to help reduce the risk is to not go in for an ultrasound for just a recreational purpose. Some women get an excess amount of ultrasounds to keep the pictures in a scrapbook. Sonographers can help reduce the negative effects of ultrasounds as well. They can do so by informing the patients of the risks that can be imposed on their fetus. After thoroughly explaining in great details the danger of excess ultrasounds to the patient, determine whether or not it is worth risking the health of the fetus. Sonographers should only perform ultrasounds on patients in emergencies, such as if a woman has had abdominal pain, to detect a problem within her pregnancy. Hospitals and facilities can also help reduce these risks. If hospitals and facilities only hire certified sonographers with a certificate present and visible, ultrasound machines would not surpass the mechanical or thermal index limit. Another thing that can be done is have an observed ultrasound exam performance. If they can properly pass this observation, then they can be allowed to perform ultrasounds on patients with regular random observation exam performances. I hope that with this knowledge you can think twice before getting an ultrasound and ask yourself if it's worth risking the health of your baby. These are my references. Thank you for watching this video.